Thank you very much for the opportunity to be here for this time. As you said, I'm from Tijuana, TJ. We can mention it like that, and I will show some of the results of our team in a multi-layer fibrous mucoadhesive drug system for oral mucosa. So we have been working several years in this topic. So I will show you some results that these projects are still in process. Okay. I'm from Tijuana, Baja California. I just take a time to show you my institution. Is around mountains, and we don't have we have few population close the university, and we are in the line border between San Diego, United States, and Mexico. So this presentation will have some small introduction. I will talk about mucoadhesives. I will explain to you or discuss the electrospinning technique, some preliminary results, some future work and conclusions. Well, today I will talk about a little bit about mucoadhesives that are fabricated through the electrospinning technique to be used for drug delivery systems. Some of the ideal features of mucoadhesives is that they have to adhere to the site of action. They deliver drug unidirectionally. They do not cause any irritation or tissue damage and do not interfere with normal functions. So this is the main properties of the mucoadhesive for oral release of drugs. And the idea is that our mucoadhesives stick or interact with mucins, which are proteins located in the epithelial cells in the oral cavity. For this, as the last presentation of Dr. Webster, there is a lot of polymers, synthetic polymers, natural and synthetic polymers that are used for the fabrication of drug delivery systems. In my case, we use some synthetic and natural polymers with the specific properties to be mucoadhesives. You can see in this table different adhesive force index present in different synthetic polymers and natural polymers. And we use these properties to create a smart system to be attached to a certain specific tissues and deliver locally the drug. And in literature, you can find several polymeric systems loaded with pharmaceutical drugs, and it's their different presentations. You can find this system as patch fibrous scaffolds that are similar to us, to our work, films, tablets, and as hydrogels. So, but what is the electrospinning technique? The electrospinning technique is a very friendly, user-friendly technique, is economic also, and is versatile. And you can fabricate nanofibers or microfibers loaded. You can load it with different biomolecules, such as proteins, plasmids, drugs, natural molecules, and so on. And this strategy, you need to create, or you need to fabricate, you need to synthesize a polymer solution. You need to prepare this polymer solution. The disadvantage, as the last presentation mentioned it, that we have to use toxic solvents, such as chloroforms. We can use ethanol. We can use different kind of organic solvents. And we prepare a polymeric solution. We put it in a stream, and we locate the shrimp in a shrimp pump in order to control the release rate of the polymer solution. Then we use a collector, a metallic collector that is conductive. This collector can be dynamic or can be static. So I will explain that what is the difference between them. And you use a high voltage supply. So you put an electrode at the collector and the other electrode at the stainless steel needle tip. And you apply a high voltage between 5 kilovolts to 35 kilovolts. And you create an electric force. When you create the electric force, the polymeric drop that you find here is attracted to the collector, to the metallic collector. So a fiber is created and the solvent is evaporated. So at the end, you will have a solidification of the polymers and it will be collected randomly. As you can see at the background of this slide, you can see the collector fibers randomly. The important properties of the nanofibers is that you can control the thickness, you can control the fiber diameter, you can prepare fibers from 100 to 1000 nanometers. There are some few literature where you can produce fibers less than 10 nanometers. One of the important things of these fibrous scaffolds is that they possess high surface area, and this high surface area creates more contact sites in a minor spatial radius. You can control this area. You can control the porosity also. You can have a small pore size, or you can prepare with a bigger size, depending on the applications. These scaffolds has low density. You can prepare these scaffolds with biocompatible polymers. They are biodegradable, flexible, elastic, with desired mechanical properties. And when you load a bioactive molecule, you have the bioactivity. Here in this slide, I show you how the fibers are prepared. You have different collectors at the upside of the slide. As you can see at the left, upper left, you can see a rotatory collector where the fibers are collected with a specific pattern. So this kind of collections is useful to improve mechanical properties of the final fibers, and you can use it for solar cells, biosensors, and so on, and some textile applications. Or you can have an static collector where you collect the fibers randomly, and this is important. This kind of collection is important for tissue engineering and drug delivery systems and other biological applications. To prepare nanofibers, you have to consider different parameters. You have to choose the adequate molecular weight. You have to prepare higher concentrations of the polymer solutions. You have to control the viscosity. The viscosity is an important parameter because high viscosity in the solution helps you to prepare the nanofibers. If you use a very dilute polymeric solution, you will have particles instead of nanofibers. The conductivity of the solvent, of the chosen solvent, is important in order to promote the electric force in the system. And that the surface tension is also important regarding the parameters of the solutions. In the process, in the electrospinning process, you can vary the voltage, apply voltage. You can vary from the distance between the collector and the shrimp. A higher distance, you will have thinner fibers diameters. And if you put closer the collector and the injector, you will have a thicker fibers. You also can control the flow rate of the release of the polymer solution and the type of collectors. And the temperatures and humidity are important too in order to the fabrication of the fibers. When you have, in some polymers, when you have high humidity, you can produce any fibers. The idea to load pharmaceutical drugs at the surface of the fibers or at the inner side of the fibers is to control the release time of the drug by the degradation time of the fiber, of the polymeric fibers. We always use polymeric biodegradable materials where I know the time of degradations. Some polymers such as polyvinyl pyrrolidone degrades in seconds. Other kind of polymers such as polycaprolactone degrades in months. So depending of the release I want is the polymer that I will choose for the system. The idea to load nanofibers, I will show you after these slices how the electrospoon fibers looks like. But the idea is to use this technology to treat kids because for kids, it's difficult to administer some pharmaceutical drugs. Always kids cry or moves a lot, of try to avoid injections. So sometimes the nurse or the mother gives a wrong dosage. So the fibers, this proposal helps to the administrator to gives the correct doses to small kids and with the correct dosage. I will explain that in a second. Also, we can use these kind of systems to avoid injections when, for example, a molar extraction is occurring. Usually, at least here in Mexico, we use some anti-inflammatory drugs such as dexamethasones to be applied at the local site when a molar extraction is occurring. So we want to replace this administration strategy by using our fibers, and they looks like that. So you can see how the electrospoon mat is degrading and releasing the dexamethasone in this case. No, we have a previous work already published, and we are working in the results that I will show you in the following slides. We have been working with the development and characterization of different multi-layers mucoadhesive systems loaded with propanolol in one case and dexamethasones in another. And we have another project where we use sildenafil citrate in order to treat heart disease. This is how it looks like electrospoon nanofibers in a macroscopic view. Here in the picture in the middle, you can see how fibers are created by the electrical field. You will not have only one fibers, you can have multiple fibers being created and located at the collector. We use an aluminum foil in order to collect the fibers and then transport easily the samples to the different characterizations techniques, or create this kind of mucoadhesive system, as you can see here. This in particular has different layers. But right now we are working with some biological characterization of this mucoadhesive that has a multi-layer system where we have three polymers working: polyvinyl pyrrolidone, polycaprolactone, and polycarboxyl polymer. These polymers, they had different different functions. For example, polyvinyl pyrrolidone is loaded with the dexamethasone drug, and this will degrade in seconds when the electrospoon patch is applied to the patient. So the polymer will be degraded and release the drug fast. The polycaprolactone serves as a mechanical scaffold and gives like a rigid structure to the system, and you can manipulate the system by this polycaprolactone. And the polycarboxyl has the mucoadhesive properties, so the patch can be attached to the tissue surface. So we already synthesized this multi-layer fibrous system. We performed some ex vivo mucoadhesion studies. We already characterized the in vitro biocompatibility of the fibrous system using two kinds of cell lines. We carry out a time test residence in vivo, and we perform a patient's acceptance test. We still missing to perform the ex vivo permeation studies. Here, this is the system that I will describe today. This multi-system has the polycaprolactone layer at the outside, at the external part of the system. This is impermeable and has very good mechanical properties. We prepare the polycaprolactone nanofibers at 10%, respecting the solvent. At the middle, we load the polycaprolactone with a polycarboxyl layer in order that the system is bioadhesive and attach easily to the mucosal. And the last layer has polyvinyl pyrrolidone loaded with the dexamethasone drug in order to release unidirectionally the dexamethasone at the tissue zone. This layer avoid, or is intended to avoid, the distribution, the wrong distribution of the pharmaceutical drugs to other areas. But still, we missing that experiment, no? We are looking for a peak tissue, oral tissue, a peak oral tissue. It's difficult here in Mexico to get this tissue. We have been working hard to get it, but has been difficult. It's not that common as you can think. So we're waiting to get the right tissue, no, to perform the experiments. This is the electrospinning conditions. We use 20 kilovolts to create the electric force. We use distance between 50 to 30 centimeters, and we use a rate of 0.3 to 0.8 milliliters per hour. So these parameters, when we are initially working, we screen these parameters. So at the first time I set up the system, I don't get fibers. So I need to screen different voltage, different distance, different rates in order to get the best morphological fibers, no morphological results, no. This kind of system, when we look for the international norms, in order to see what kind of studies I had to make for this medical device. As you can see, we are talking about a mucosal membrane, and the idea is that this membrane are used only 8 hours, so it's a limited contact durations. So I need to perform these three testing, no? Cytotoxicity, sensitization, and irritation or intracutaneous reactivity. So we performed some of these studies already. I will show you a little bit of them. And the idea is to get all the necessary characterization to see if we can go further, no, to apply to the final user. So in the case of the fibers diameters, we get diameters of 1 micrometers. We decide to use this kind of diameters is high diameters, is that the fibers are very thick, 1000 nanometers, because we need to have good mechanical properties. So if you have thicker fibers, you have better manipulation of the system. So we decide to produce fibers with 1 micrometers approximately of diameter, and we have a thickness of the final system of 4 millimeters. So if you take a picture in a scanning electron microscopy, you can see the fibers like this. So here you can find some thicker fibers and some thinner fibers, no? We still can optimize this morphology in order to have similar diameters. We also perform already adhesion, a mucoadhesive assay using a Brockfield texture, CT3 texture. And for this, we put the sample in contact with a rabbit intestine tissue for 120 seconds and apply a force of 1 Newton. This assay was performed inside a buffer 6.8 at 37 Celsius degree, trying to simulate oral cavity conditions. So for these results, we try to find some results in literature in order to compare our results with literature, and we did not find too much literature. So we need to compare. So we compare the mucoadhesive system, MCS, the mucoadhesive system against the pristine polycaprolactone fibers. As you can see, using the polycarbophyll polymer in the mucoadhesive system, the detachment force, the adhesive bond strength, and the mucoadhesive strength increase or improve very high, no, compared to the control, no. So this, for example, this mucoadhesive strength is is a little bit low of what are we looking for. We have been looking for maybe 500 of gravity, 500 or up, but we can still optimize the proportion of the polycaprolactone. But this test was in vitro. We also perform an in vivo test. So I think the performance of the detachment was adequate. Respecting with the biocompatibility or cytotoxicity of the mucoadhesive system, we expose to fibroblast cells, HFF1 cells, and polynuclear blood mononuclear cells, I'm sorry, peripheral blood mononuclear cells, such as monocytes and lymphocytes. We expose these cell lines to different layers of the system. For example, we have a PVP pristine nanofibers, the second layer, the third layer, the mucoadhesive system, the polycarbophile polymer alone, the dexamethasones, and so on, no? And a control, a positive and control. So as you can see, not much cytotoxicity we can find in these elements. But the samples that has dexamethasones, for example, this one, these dexamethasones in these two cases, and the SCD also has dexamethasone. I'm sorry for the level, the level of the samples, but these two has dexamethasones, and is highly known, is already known that dexamethasone has certain cytotoxicity. So it's expected this result, but when you have the whole system, we have a pertinent or adequate cytotoxicity, because if we look for the ISO 10993.5, we see that if you have more than 70% of proliferation, these values are proliferation percentage, the cytotoxicity is fine, is pertinent, is tolerable. You had a small, this one is middle toxicity. If it get down, if you had less than 70% of proliferation, it says that you have a moderate cytotoxicity. But in all samples, we have an adequate cytotoxicity for both cell lines. We use for this test the MTT assays, and in this assay, we test the mitochondrial functionality in cells by evaluating the effectivity of the succinate dehydrogenase enzyme that is located in mitochondria and is useful in the Krebs cycle to produce energy. In this case, we add a dye known as MTT and is reduced for the mitochondrial enzyme. And if the cell is alive, will reduce the MTT dye, and we will obtain a formazan compound. This formazan compound produce a color, like a purple color or brown color, and you can read it in the spectrophotometer and quantify the proportion of live cells. We also perform in Syrian hamsters, this in vivo testing, and we want to evaluate only the irritation test that we saw in the ISO that I showed you before. And we put the samples for 8 hours of exposition in the oral mucosa of the hamsters. Of course, using veterinary and physicians as collaborators in this kind of experiments. And the physician, the pathologists, they classify different immunological reactions against the fibers, against the samples, and they conclude that there is no epithelial disruptions, no ulcerations, there is no necrosis, there are no allergic patterns, and in conclusion, there is no significant damage. This is the conclusion of the collaborator, pathologist collaborator and veterinary. And for that results, such as cytotoxicity in vitro and in vivo in animals, in small animals, we perform a patient acceptability test in humans, in volunteers. So for the volunteers, we use 15 volunteers, and we only put a placebo mats. This means without the dexamethasone drug. We only put the mats, and the idea is to test the acceptability of the patient. No? We have some inclusion criteria, such as the age. We can use both sex, but the volunteer has not to be smokers. And if you have certain condition in the oral cavity, that you were excluded. No? We prepare a document to inform of the project to the volunteer. They sign, and they were cited and explained it and educated about the topic of the research using these normativities that are here. And the idea is to test that the detachment time of the membrane, the size, how the patients feel the size of the patch, the taste perception, if in the application area has irritation, you have irritation, and if the volunteer feels dryness or salivation. So this is a kind of query that were applied to the volunteers after they have the membrane located in this part of the oral cavity, the mucosa. So the idea is to locate this membrane at the site where you will have the extraction of the tooth. Depending on the site, the idea is that the patch attach and do not go away. No? So the average patch retention after the experiment was 106 minutes. No? So this detachment time was adequate for us. So 40% of the volunteers has the patch about 2 to 3 hours. So this resource is fine for us because the release of the dexamethasone has to take about 20 minutes, 20-30 minutes, but we use higher times in order to have some limitation times. 30% of the volunteer has less than 30 minutes when the membrane detach from their mouth. 100% of the volunteer says that they do not have irritation. They don't feel any dryness. The salivation was regular, that they don't feel any change in the salivation. And 80% of the volunteers says that they don't have any interference when they talk. So 20 of them says that they have something weird. They feel something weird in the mouth. So that's why they put that they have some low interference. So from the preliminary conclusions, so we already test the adhesion time to the site of action. I think we have good results, but we need to optimize the system. But we had good detachment times, no? We already test that these fibers do not cause any irritation or tissue damage in vitro, in cell lines, fibroblasts, and blood cells, and in hamsters, in the oral cavity of the hamster, and with the acceptance test in human patients, we see that do not interfere with normal functions. So still, we need to perform this to demonstrate that the fibers release the dexamethasones unidirectionally. So that's why we need to make the Frank cell procedure, no? But for that test, we need pig tissue, pig oral tissue. So, and it's difficult to get. Some literature has published with rabbit intestine tissue, but we want to perform it with the pig because it's more likely to the human tissue. And thank you for the time. And I don't know if you have any question.
Thank you, Professor. Let's see if you have any questions from anybody. I request the participants to please respond if you have any questions I would like to mention. This might be your last presentation of our conference. I don't see the last presenter responding to us yet. So, any questions from anyone?